Okay, so we're going to start our webinar. What we learned from COVID was we have to change our lifestyle and live a healthy life. And if we are overweight or obese, somehow with the, what we learned from COVID, we need to get down our weight. And that was something we learned from COVID. So today, I'm presenting the webinar. My name is Ron Eli. I'm the CEO and founder of Mexico Bariatric Center, and I have pleasure to have Dr. Jacqueline Osuna. She is joining me actually from Guadalajara, Mexico, and you can say hi to our attendees, and that's what we're going to start doing. Again, if you have not filled out the health questionnaire, go ahead and do that. And Dr. Usuna should be the surgeon of your choice for requirement to enter our $2,000 off of surgery raffle. We try to answer questions that is mostly asked in our presentation. And if not, you can use the Q&A tab and type your question there, and at the end we get to answer all of it, or at least hopefully most of it. Today's topics, we're going to talk about obesity, risks of being overweight, undergoing weight loss surgery in Mexico. We talk about MBC and what we do. Then Dr. Usuna will take over the presentation and talk about bariatric surgery options. After that, we do the Q&A, and then we do the raffle. Basically, obesity is becoming a worldwide problem to a pandemic proportion. It's a chronic disease, and basically, there are several factors that is our genetics, our environment, our lifestyle, lack of exercise, conveniences in life, fast food. These are all contributing. The sugary drinks are contributing to this problem. One thing I can tell you about here in this graph is when we gain weight, our fat cells change the structure, and not only increase in numbers, it also changes. It becomes increased in size, and it changes the structure, which causes all the other problems, which is insensitivity to insulin, to leptin, to medications, to vaccination even. Oh, I'm not into, I'm sorry, let me go back to. And basically, there is a formula that you enter your weight and height, and that gives you a number, and that puts you in the chart, which determines if we are normal, overweight, obese, or even morbidly obese. So the cutoff is at 30. That's for requirement for our center that we go with a BMI of 30 or more. There are some exceptional cases, especially Dr. Usuna accepts if it's 28 or 29 based on other conditions. If you have metabolic disease or your age, all that is a factor. Obesity is impacting about 40% of adults in the US and has major risk factors, as we know. I like to play this little video always, which shows what happens when we gain weight.
Consider this, our diaphragm is one of the major vessels that helps us breathe. Breathe in, and the diaphragm contracts, and the lungs expand, it's open oxygen.
So basically, that shows you what happens when we gain weight, among other underlying medical problems like diabetes type 2, heart problems, stroke, lung disease, impaired immune system, like we talked about, insensitivity to leptin and insulin, chronic inflammation, and like we talked about, when COVID came, COVID was attaching itself to the fat cells, and the more fat cells you had more breeding ground for catching COVID, and that's what happened. Talking about COVID, 113% of obese patients are more likely to end up in a hospital. 74% ended up with being in ICU, intensive care, and 48% more likely to die. Of course, the pandemic itself did not help us by, being isolated, and the gyms were closed. There was not much to do. So that may not have even helped the obesity problem in the world. And you may ask me, okay, so what's the solution to lose weight and not have all these problems? So the first thing, of course, is diet, exercise, and medications. But as we know, diet and exercise is not a long-term solution for obesity. You lose weight short-term, but it's hard to maintain that weight loss. Bariatrics, however, is a proven, quick, safe, and long-term way to lose weight. I look at weight loss surgery like magic. So when you go through the surgery, your metabolic system changes. And it's like you're getting a reset. And this graph on my right of my screen shows what happens. Let's say if an individual weighs about 250 pounds, their body, brain, the hormones, the interaction between them is used to operate around that 250 pounds. Now, when you go through diet and exercise, but we're talking about heavy duty exercise like boot camps and diet. Let's say you manage to lose 75 pounds and you go down to 175. What happens is because your body is used to that 250, it's going to fight back by making you more hungry and lower your metabolism. Now, if this patient goes through, let's say, gastric sleeve, gastric bypass, and lose the 75 pounds, the minute that patient wakes up from the surgery, your hormones are operating and interacting with your brain in a different way. It's like you resetting your metabolic thermostat and your body gets a reset. And that's when your body is not going to be hungry as much and your metabolism goes down, it goes up. That's why you burn the fat fast. In maybe 2 years, you lose almost all the extra weight, extra fat that you have. For people who are uninsured, underinsured, people from Canada, for example, that they have to have a long wait list to get this life-changing surgery. That option is to go across the border, and Mexico has established itself, Tijuana, as one of the highest quality and volume of bariatric patients traveling to. So this is your option. Medical tourism. Of course, you know, you want to research the company that you go with, but if you end up with the right company, you're going to get a quality VIP treatment at a much lower cost than you can get it from US or Canada if you were to pay out of pocket. Mexico Bariatric Center is on the forefront of medical tourism for weight loss patients in Mexico. We just hit our 10th anniversary, October, and we've been in business for 10 years, over 20,000 successful surgeries. We are a US-based company, our headquarters in Sacramento, and since the inception, our commitment to helping patients cure obesity by providing highest quality weight loss procedures in Mexico for the most affordable prices. Like I mentioned, we've been around since 2012, October. So this is our 10th anniversary. This number is outdated, so we have had 20,000 patients, and we work with 7 top quality bariatric surgeons. Our process is very simple. It's like 1, 2, 3. You fill out the health questionnaire, you get your approval with the surgeon, you put the deposit so you can be added to the calendar, you find the spot that works for you, and the surgeon has opening, and you book your flight or you arrange for your travel and finish your paperwork. You start your pre-op diet, and you are on your way to get this life-changing procedure. We offer all-inclusive packages that covers surgeon fees, hotel nights, hospital nights, pre-op, post-op diets, medications, hospital fee, of course. We do have nutritionists in our staff. We have established post-op care and Facebook support group, transportation, all those included in the package. So the best time to go through this surgery is right now. Let's make a decision and get on the calendar and get this life-changing procedure. The coronavirus, COVID-19, really helped our company in a way that we got even stronger because we had to overcome the challenge that COVID presented at the time. And since then, we have been even stronger company with stronger protocols down there. So it was a setback, but after that, we became strong. I mentioned about our support group. That's huge to have support after your procedure, because the procedure is only 50% of the equation. You need to still do your work and do a good job on your post-op diet, on your lifestyle changes, so you can be successful long-term. Of course, you know, your diet after surgery is most important. Taking multivitamin for bariatrics is also very important, that we go over it at the end. Our Facebook support group, we have actually 2, but one of them has over 10,000 patients. And you get real-time support from past patients on our staff. We have 4 of our past patients that we call them, basically they are there to support you on Facebook and other channels. These affiliates are working with us every day and working with patients and becoming like a glue between us and the patients. They do have podcasts periodically. Actually, Sarita and Rena. Sarita is the lady on my lower left, and Rena is my top right. The one lady on my left top is Judy, and on the lower right is Kelly. We work with exceptional team of drivers that we have been working for so many years. They know what they're doing, and time they have come to show their experience and their knowledge of what they're doing down there. We'd like you to arrive before noon in San Diego, where we pick you up. And of course, you know, some people opt to drive down there, which is okay, or drive to San Diego and get picked up, or fly, of course. Your departure, we like you to get your ticket or your arrangement to be around 1 or 2 p.m. on the day that you leave. Again, for people who joined us after I started, we require for you to have a HQ in our system. If you haven't done it, please go ahead and do so. If you have, no problem. Even if you have a different surgeon, we can switch you to Dr. Osuna. And of course, we like you to stay to the end of the webinar until you do the drawing. I mentioned about the 7 team of surgeons. This is not to be taken lightly. Of course, MBC has so many positives and so many aspects that we offer to patients. And this is one of the biggest advantages when you're working with so many surgeons that have been doing this for years. The amount of expertise and the amount of variety of procedures that we offer is incredible. Of course, Dr. Osuna that is here with me, we will go over her profile, but other surgeons, Dr. Montalvo, Dr. Valenzuela, Dr. Gutierrez, Dr. Lopez, and Dr. Jesus Ceja. This is another aspect that you get from MBC that is irreplaceable. The patient basically interface with our 7 team of surgeons through what we call surgeon liaison. This is a medical doctor that is sitting, and she's bilingual. She's sitting between every HQ that gets submitted and makes sure that goes to the right surgeon and get the right procedure. And also, you know, when to start or stop the medications you're already taking, all those instructions will be sent to you, and she makes sure those are accurate. For our pre-op diet, we require the number of days that you are on the pre-op diet based on your BMI. And if your BMI is less than, let's say, 34, we just need you to do the 2-day clear liquids. If it's, let's say your BMI goes toward more like 40, we go to 1 week or more. Again, depends on your BMI, but this helps you to understand where you are at and how many days you need to do your pre-op diet. Pre-op diet is not very difficult. Basically, we want you to be on a low calorie, low sugar carb diet and more protein, maybe protein drinks, salad with chicken, maybe fish. So that should be pretty much your diet. If you do a good job on your pre-op diet, it's going to help you and it's going to help the surgeon in the procedure. We use at this point hospital, Me Doctor, which has been in business for so many years, is one of the pioneers of bariatric hospitals in Mexico. And we use Hyatt Place and Fairfield Marriott for our patients to come in the first day and relax and be ready for the surgery the next day. Your companion would stay in the hotel when you're in the hospital. And that happened after COVID because we didn't want so much contamination to be in the hospital and expose not only the patients, our staff, and hospital staff. On the day of the surgery, they tell you when to show up in the lobby of the hotel. So get picked up, they take you to the hospital, and we do all the preparation for your life-changing procedure. We keep you 1, 2, 3 nights in the hospital based on your procedure. We do several leak tests, including most of our surgeons use drain. And after that, when you're ready to go back, we pick you up and we take you back to San Diego, where you can travel back home. If you're flying longer hours or you're driving longer hours, we recommend that you get up every hour or so and walk around. Make sure you have the compression socks as well. One of the reasons we have been so successful and our complication rate has been so low is what we call surgeons load management. So we have 7 teams of surgeons that they get maximum of 3 or 4 surgeries per day, depends on the complexity of the procedure, of course, and that has contributed to the high success rate and low complication rates. We offer a wide spectrum of procedures, but this chart pretty much shows what population is good with what type of method to lose weight, right? So bigger population are okay with diet and exercise, then some smaller population are good for medication. And then it's what we call endoscopic procedures. And then it comes laparoscopic procedures. And we will go over that. But this chart pretty much shows the weight loss management spectrum. As I mentioned, we have a complete array of bariatric surgeries that it's unique in be offered in our center. We have laparoscopic and endoscopic. Laparoscopic basically entails, well, gastric band is pretty much outdated, but we use it once in a while. We do gastric sleeve, which is VSG, very popular procedure. About 90% of our procedures are VSG. Mini gastric sleeve, we do mini gastric sleeve on a very limited basis. Of course, you can get the gastric sleeve with 1 incision only if your BMI is less than 40. We do the popular gold standard RNY gastric bypass, mini bypass, duodenal switch, SADI, and different revision procedures. And we even do reversal of procedures if it's needed. For endoscopic, of course, the gastric balloon, the newer procedure will be called endosleeve or endoscopic sleeve gastrectomy, ESG, and revision of previously failed bypass which is done endoscopically and is called TOR. This is a chart for eligibility of who can get what type of surgery based on age, BMI, and as you see, we cover pretty much from 16 to 65 years old and BMI of 30 to 90. And this is requirement for endoscopic surgery. Endoscopic surgery works well with BMIs of less than 40. I'm getting to a point to introduce to you Dr. Osuna. She's one of the most skilled and experienced surgeons in Mexico. She actually lives in Guadalajara and travels every other week to Tijuana. So she does surgery both places. She has over 10 years experience in weight loss surgery procedures, and easily she has done over 2,500 procedures. She's of course a certified surgeon, and she attends all the international congresses like IFSO, IFSO, and you name it. She attends all the, so to be updated to what she does. So I'm going to let her actually take over from here and explain why she became a surgeon and tell more about herself, and then we go over the procedures. Thank you so much.
Do you hear me? Yes. Hello, everyone. Like Ron told you before, I'm Dr. Jacqueline Osuna, and I work with Mexico Bariatric Center. The reason that I become in surgeon is because I like the medicine to cure and to help to the patients. And when you make surgeries, you could make that. You could help persons to have a better life, and you could help persons to resolve the problems that they have. I have 15 years of experience performing bariatric surgeries, which include gastric band, gastric sleeve, cells, bypass, midi-gastric bypass, duodenal switch, and the revision of the previous failed bariatric surgery. I become in surgery in Mexico. I made general surgery in Centro Médico Nacional de Occidente here in Mexico. I also did a rotation in the Colconi Hospital in Chicago, and I trained in bariatric and obesity surgery in Tijuana here in Mexico. I think that it's important to all surgeons, the practicing, the experience, and of course, we have always to be learning. That's why it's important to go to the national and international congresses, because it's the most important thing to offer to my patients safety and very good results. That is the most important, I think. Okay, the most frequently surgery that patient asks sometimes is gastric sleeve surgery. The gastric sleeve surgery is we remove the 80 to 85% of your stomach, and you lose weight by two ways. One, because your stomach is the smallest, and the other is because we take off the part of the stomach that produces the ghrelin. The ghrelin is the hormone that gives you hunger. That's why you're going to lose weight, but that two ways, because you are going to eat less and you are going to have less hunger. And the expectations about after gastric sleeve is you are going to lose to 65 to 70% of your excess weight, we, like I told you before, we remove the portion of the stomach of the ghrelin, of the hormone, and you're gonna have less hunger, and you're gonna decrease the intake, and it like in other surgeries is minimally invasive. And the pros after a gastric sleeve is that if something happens after the surgery, like you are gaining weight, it's a easily revisit surgery, comparable weight loss to a gastric bypass, and is less invasive. And we have no change in the anatomy after the gastric sleeve. Your digestive system is the same after and before surgery. And the short is a short recovery time too. And if you are a patient that have reflux, this is the contrast of the sleep. If you have acid reflux previously, we prefer to advise, if you have another, if you prefer, and we advise, it's better a gastric bypass, because in some patients increase the acid reflux after the gastric sleeve. It's the thing that I explained you before. It's the stomach after the gastric sleeve is like a small tooth. It's a restricted procedure. You're going to have less hungry, and you are going to have more satiety. And the gastric emptying, the stomach that we left after surgery, after gastric sleeve, is enough to absorb all the nutrients. The first 6 months we advise to take vitamins, but after the size of the stomach is enough to absorb. And the other is the single incision gastric sleeve surgery. Inside is the same surgery of the gastric sleeve, but it's different approach. It's only that difference. The approach, it's with a small incision around your belly button, but inside is the same of the gastric sleeve. Only is different the approach. In endoscopic gastric sleeve surgery, like Ron told you before and explained very well, it's not for all patients. We prefer for patients to have that less than 40 of BMI, and the important thing in this is that it's less invasive. You are not going to have a surgery. You are going to have a procedure that is an endoscopy. And while the endoscopy, we made the sleeve, but we don't cut that part of the stomach. And it's a revision. It's a surgery that it could be very good if you need some revision. We don't have any problem to do some revision after an endoscopic gastric sleeve. Okay, the gastric bypass surgery. This procedure is still the gold standard in the bariatric procedures, but it's not for all patients too. In this procedure, we made a small pouch of your stomach, and that small pouch is connected to the bowel, and one part of your upper bowel is bypassed. That's why you are going to lose weight. Why? Because you are going to have a small pouch, you are going to have you are going to eat less, and it's malabsorptive procedure. The part that we bypass with the surgery is the part that the fat is absorbed. That's why it's a malabsorptive procedure, because you are not going to absorb the fat in your meals, and you are going to lose weight because the malabsorptive and because the restrictive procedure. This procedure is more indicated in patients that have previous acid reflux and the patients that have more chronic diseases, for example, like diabetes and hypertension and heart diseases. Is more indicated. The procedure is takes a little more time in the peritoneal root because it's bigger than in a gastric sleeve, but it's preferred in that kind of patients. It's a procedure that you could review. It's and because you could review the size of the pouch and of the lumps of the bowels. You are going to lose weight from 70 to 75% of your exact weight. Okay. Like I told you before and explained you, not all surgeries are for all patients. For example, in gastric sleeve, we prefer in patients that have more than 30 of BMI, and if the patient have a previous ulcer, you could do the surgery without problem, because we take off all the remaining stomach, and we can reduce that surgery if you have problems with that, but it's not frequently that you have problems with that surgery. And the anatomy and the digestive is the similar before and after surgery. We don't alter the anatomy. And in the gastric bypass, we prefer in patients that have more BMI. When the patients have, like I explained you before, if the patient have acid reflux, it's better for the patient because help to the acid reflux. And with people with a slower metabolism and the people who used to eat more sweet. And the anatomy, it's altered, like I told you before, because the small pouch connect to the bowel and we bypass one part of the bowel. And for that situation, you have to take multivitamins all the time after surgery. Okay, the mini gastric bypass is not is the name mini, but it's not like a mini. The correct name is one anastomosis gastric bypass. Why? Because in the gastric bypass, we made two anastomoses, one with the stomach and the bowel, and the other the bowel with the bowel. In the mini gastric bypass, we only made one anastomosis. We made a pouch with your stomach, and we connect the bowel to that part of the stomach. It takes a little less time in the operating room that the complete gastric bypass, but it's similar the results. But the expectation is that you're going to reduce the feeling of the hunger, if you are easily satiety and feeling full, reduce calories and nutrients, and resolves diabetes type 2 and more. It is too similar, that expectations with the gastric bypass, and the pros is that, like I explained you before, only one anastomosis, it's less time in the operating room, and it's safe and is similar in effective in the effective like gastric bypass. And we can review after a gastric sleeve and a light band, we can review with a mini gastric bypass. And you could have in the cons, you could have the vomiting and dumping syndrome. It's not too frequent that you can have it, and the high risk of ulcers is present. And when you have the reflux of the bile to the stomach, we have to convert to the complete gastric bypass, but it's not frequently too, but we have to let you know. And in these patients, we can choose in patients that that have a very big BMI, and we have other pathologies around like heart disease, and we want not to stay a very long time in the operating room. We could be a decision in that patients too. Okay. Deciding between gastric bypass and mini gastric bypass, gastric bypass is similar in the decision of the BMI. Only like I explained you before, in patients that we don't want a lot of time in the operating room, we could change that situation. In patients that have marginal ulceration, we prefer the gastric bypass. And in the acid reflux or GERD, we prefer the mini gastric bypass. And we are going to less more weight loss in the gastric bypass because it is still the gold standard. And you are going to have less nutritional deficiency in the mini gastric bypass. In diabetes, we prefer the complete gastric bypass. It's a longer procedure, and in patients that we want less time in the operating room, we prefer the mini gastric bypass. Okay, the duodenal switch is known like biliopancreatic diversion 2, and duodenal switch it's a powerful weight loss surgery, but we can make in these patients to when the patient have diabetes, we could take the decision of the duodenal switch too, but we have to take care of that patients because we have to be ensured that the patients take all the pills after surgery, because we have the higher risk of the malnutrition. But you could lose the 80 excess of the weight loss. The most surgery in this surgery you can lose the most. It's similar to the gastric bypass, because in the gastric bypass is 75%, and in this is the 80%. And okay, in diabetes, like I told you before, malnutrition. If you go with all the medical instructions and nutrimental instructions, you could do that. You could have the duodenal switch without problem. The problem goes when you stop taking all your vitamins and all your nutrients. And the pros, the loss of the 80 excess of weight, the stomach of the size is reduced. It's like a sleeve, and we connect to that part of the stomach the duodenum. And okay, the average is 80% to lose. Okay. with the times of COVID, we Mexico Bariatric Center is prepared to do it with all the security for you. We have all the tests that you have to have before the surgery, and if the patient have the risk of have a complication, we talk to the patient. We make all the studies, the necessary tests to be ensured that you have the surgery with all the security for you. The things that we want, like surgeons and like and with Mexico Bariatric Center, it have a very successful patients, but have the less range of complications and all the security for all of our patients. Mm-hmm. This is important for prevent the COVID, and we always do it in all the time. All the surgeons who are only have the vaccination, and we ask for you, and we use all the prevent situation for prevent contagious for you and for all patients. This is so important because some patients think that after bariatric surgery they have to have a lot of time of recovery, but the laparoscopic surgery gives you a very good advantage. That's why we don't have any problem to the patient to go to come to work after 1 and 4 weeks. It depends the situation, but after 1 week, you are ready to do almost all things, except to lift, except to push. But after 1 week, you are ready to do all the things that you used to do. And even though you have a previous open surgery, we always try to do it our approach by laparoscopic, because the recovery it's very good after laparoscopic surgery.
I'm going to take over from here. Thank you so much for taking time and explain all the different procedures. We offer financing options through third-party companies like Supermoney, eFinancing, United Medic. Well, they call themselves United Credit, and Medicard. Of course, you can go through individual lenders for personal loans like SoFi, Best Egg. There's a list of them here. Lending Club. Those are all good choices. The only thing that you don't want to do is apply for a bunch of these loans at the same time, because every time you apply, it hits your credit. And then if you do 2 or 3 at a time, it would affect your credit score and you may not qualify. So it's time to go over all the questions you have in the Q&A section. So one of the questions come up, as Dr. Osuna mentioned, is like, we want you to do the COVID test before you come, and preferably you're vaccinated, but we don't require it anymore. So we don't require that you have COVID test, and we don't require you have vaccination, but it's highly recommended that you do a COVID test before you come. So one of the questions was asked, like, if my BMI is low, would I still lose 100 pounds with maybe gastric sleeve or even with Mini bypass, if your BMI is low, would I lose the same amount as someone else uses, or is just a percentage of my excess body fat? Can you answer that, Dr. Oh, you're still
Yes,
on mute.
when you have a low BMI, you are not losing the same weight of the other patients that have bigger BMI. It's more related for you in special for each patient. And we accept some patients with the low BMI with other characteristics. For example, the risk of, or the high risk of diseases, the family of diseases of the diseases in but itself. But it's not, you are not losing the same weight. It's about your excess of weight, not in general.
The question has been asked about companion. Just to let you guys know, over 50% of our patients come alone, and they're totally fine, because from the minute you land or you are arriving at San Diego International Airport, you are picked up by our staff. You go to the hotel, there's our staff there waiting for you. In the hospital, the same thing. We have our coordinators in the hospital. So there is no point that you are there by yourself. And of course, there are other patients that you usually interact with and become buddies, but that's like not the case that you're always left there by yourself. So you mentioned when you were presenting about mini bypass and gastric bypass that there is a minimum BMI that you have to have if it's your first procedure to receive gastric bypass or mini bypass. And then Dr. Osuna kind of mentioned about the difference between sleeve bypass and mini bypass. There are, like she mentioned, not every, for example, sleeve is not good for everybody. It's good for a lot of people, but there are certain population that really need to get a bypass or mini bypass or DS. So you really have to do a case-by-case study. And that's why we have you do your health questionnaire and have the surgeon reviews it, so you can ask them, what is the best procedure for me? You also have a chance to talk to them when you go down there. So if you sign up for a procedure and then you talk to the surgeon before surgery and they say, oh, well, maybe sleeve is better for you or bypass is better for you based on your smoking, your, how much snacks you eat every day, or, all those criteria. If you're taking Advil all day, or you need to. So these are all determining factors when you go through the surgery, and we make sure we get the best option that fits you. So they're talking about, they're asking if I have had open incision surgery before, can you still do laparoscopic this time for revision? And is there any increased risk of complications?
Yes, we can. If you have previous open surgery, you could have a laparoscopic revision surgery. The risks increase a little more. Why? Because we have to take off all the scar tissue before the surgery, and sometimes to take off all the scar tissue before surgery takes more time, like like if we only make the surgery. But we always try to do with all the security to prevent complications. It takes a little more time in the operating room, but we always try to do it laparoscopic because it's more benefit for every patient.
I'm trying to find the BMI. There is a question that says if I weigh 250 and I am 5'3", can I still get gastric sleeve? Of course, but you can answer that. So 250, the 5'3",
The BMI.
that's a BMI of 44. That's a yeah.
Yes, it's a very good candidate to have a surgery. Some patients thought that for have a bariatric surgery, you have to have a lot of excess of weight, but it's proven international committees. It's proven that after a 40 of BMI, it's only the 5% reach the goal with only exercise and diet. That's why you don't have to have a big BMI to have a bariatric surgery.
What is the minimum BMI for mini bypass?
It depends. It depends. It's not only the BMI. It's around all the disease or the risk that the patients have. If the patient have 35 of BMI and the patient have a high risk of diabetes because of the family, we could take the decision for make the mini gastric bypass without problem.
Oh, there was another question. They said about hidradenitis suppurativa. They were asking a question about that. Hidradenitis suppurativa. Where was it?
Where is that?
They have a disease. I don't know if I say it right. Hidradenitis suppurativa.
Okay. There's no problem to perform the surgery. It's a disease of the fat and the skin tissue, and we don't have any problem to perform the laparoscopic surgery.
So they're asking, what is the percentage of scar tissue and blockage to the new rerouted incision with the DS surgery? I've heard stories about that happening, so I'm worried about that surgery I'm wanting the most. So they're asking about the percentage of scar tissues and blockage.
The question is that it's the scar tissue
and blockage in the new rerouted incision with the DS surgery. I think they're asking when you reroute the intestine stuff, what is the chance of getting blockage?
Okay, it's more difficult because it depends. For example, if you have a BMI adequate for the bariatric surgery, and you have that previous surgery of the blocked intestines, we could try to do laparoscopic, and we advise, and we prefer advise the gastric sleeve. The gastric sleeve is less invasive. Is gonna we don't have to have connection with all the bowels. That's why in that case, we prefer to perform a gastric sleeve. If it's necessary to do a gastric bypass, we have a more risk for lesion your bowels. That's why in that case, we prefer the gastric sleeve.
Well, okay, so one question was that the patient was not sure if they want to go to Mexico to get this procedure. So like we talked about at the beginning, medical tourism and is an option for people who need to get this procedure, but their insurance doesn't cover, or they have to wait a long time to get it free of charge in their country of origin. So, of course, not every company has been created the same. You know, just having a website and putting some surgeons in there and create a nice presentation does not say much about the company. You need to do your research. You need to see how many reviews they have on Google, their previous patients' videos, testimonials, all, and find out about their surgeons they use. Are they just using an inexperienced surgeon, or they have surgeons that have been around for a long time and they have expertise to do different type of procedures. We see that often that other companies, they offer very limited amount of procedures, or the BMI of patients that they cover. They can do surgeries very limited. So that is not good, because you are going with a company that may give you a procedure that may not fit you, because that's all they can offer. And that's not what you really need. Let's say if they're not capable of doing procedures for bypass for certain BMI, and you need that, but your BMI is high, but they end up giving you sleep. So if they can't perform high BMI patients, and they're not expert in that, if they can offer duodenal switch, of course, those are very specific for patients. But if that's what you need, but they don't offer that services, so you are stuck with the procedure for the rest of your life internally that you can't even see, but it's going to be affecting your life in a negative way. So, so these are all factors when you research a company. And but overall, Tijuana and Mexico as a whole has a very, powerful resume for the bariatric procedures, and they offer legit, surgeries that you are comparable to US or even better, with the surgeons that are high caliber, like Dr. Osuna. These are the surgeons that are hard to find, even in US and Canada. So you do your research, but Mexico is a great option. The safety that we offer, because of the experience we have in transporting patients, managing the coordination, all the movements that they make down there, all the dynamics that we know. I would say this is a great option, and it's really a good experience when you go to a different country like Mexico, and the hospitality that they have, and they offer very good experience for you, and it will be living with you forever. We get a lot of patients that after they leave, they say we left part of our stomach and our heart in Mexico. So yeah, so that's something you want to look into. Yes, this webinar is recorded, and actually we would usually post it on YouTube, or you can ask your coordinator to get a copy of. As far as the follow-up, when you get back home, you may want to get back with your general doctor, physician, maybe in 3 months, and do a blood test. Make sure your vitamins levels, things like that are checking. We also recommend that you do a blood test before you come to us. Of course, we do our own pre-op tests. That includes blood tests. However, especially if you're a revision procedure, if you're a revision patient, you want to make sure your hemoglobin levels are over 14 or close to it. So this way, when you come, we don't have to worry about blood transfer and things like that. Or you may actually not be able to receive the procedure, and then you may have to go back. So that's an easy way to do a test and make sure everything checks before you come. So we did go over the recovery, and we did say no heavy lifting after surgery. And even if you want to do heavy duty exercise, wait at least 6-8 weeks, listen to your body. You can still walk and do all the other stuff, but nothing heavy. So if they have fatty liver, is that going to increase the risk of their complication?
The fatty liver is an indication for a surgery, because surgery is going to help to the fatty liver. But we have to prevent, and we have to prevent the complications with the pre-op diet. If you made the pre-op diet, you are going to reduce the size of your liver. The liver is so noble to the change in your food. That's why 1, 2, 3, 4 weeks of pre-op diet helps a lot to prevent complications in the surgery. But fat liver, it's an indication for a bariatric surgery, of course, with other things around. But we have to prevent complications with the pre-op diet.
How about PCOS? They're asking if I have PCOS, does VSG help PCOS?
With bariatric surgery could help to that situation. Why? Because it's a hormonal problem, and when you are submitted to the bariatric surgery, the surgery and the weight loss is going to help to accommodate all the hormones, and they are going to help to control it, and in some patients help to have a baby because some patients with PCOS have a problem to have a baby, and after the surgery, it's more probably that you could do it, and it's more probably that you control the disease.
Now, back to this idea of going to Mexico to get bariatric surgery. Of course, there are some that don't recommend that to you, but we do have a lot of general physicians, doctors that they send their patients in our way. And we've had actually doctors in Texas and other places in Europe that themselves they came and that had the surgery with us. Our own surgeon had surgery with us. Dr. Valenzuela got gastric sleeve with Dr. Gutierrez. So if it's trusted by our own surgeons, then it says a lot about our services. Can vaping cause a risk for my procedure? Vaping.
The what?
Vaping, like smoking,
vaping is like a smoking in this moment. Why? Because the substances that you use for the vaping are sometimes are not studied and sometimes are bad for the lungs. That's why we advise to quit, like in smoking, we advise to quit unless 2 weeks before surgery. The preference is 1 month, but if you couldn't, unless 2 weeks before the surgery, it's a more risk for your lungs, and that's why it's the advice.
So they're asking if somebody had weight loss surgery before and now they have gastric bypass, is that increasing the complication rate and they have to stay more in the hospital?
In what situation? I don't understand.
If they had like a gastric sleeve and they get a revision to bypass.
Oh no, it's obviously it's a little more time in the operating room. It's because I explained you before, we have to take off all the scar tissue and after proceed to the surgery, but it's a medium time that we use for take in the hospital. Usually patients doesn't need more time that the time that we told before to get the decision. And the complications we have to prevent all the time, and we have to be ensured that you don't have any complication before you leave the hospital. And we leave it in the operating room. We made a leak test in the operating room, and the next day we made another 2 leak tests for being sure that you don't have any problem before you leave the hospital. We after the first day, we're going to let you know how was everything. We're going to let you know, oh, okay, you are going to need more time because this happened in your surgery, but the most of the time we don't have more time in the hospital after a revision.
What is the percentage of people who gain the weight back over 10 years?
Over what?
10 years after surgery, what's the percentage of people who regain weight?
After what kind of surgery?
Okay, what is the percentage of people who regain weight after 10 years post-op surgery?
Okay, after 10 years of bariatric surgery, it's not a big percent after to have a right bariatric surgery. If we choose the perfect surgery for each patient, its percentage it's very low, and it has to be, you don't have to be a revision after the first surgery, because we choose the better surgery for the patient. It's not frequently to have a revision, but it depends of the previous surgery. It depends of the technique. It depends of the patient too, and it's a combination. It's a combination. That's why if we choose the best surgery for patients, it's a low percent of the patients that regain weight after bariatric surgery.
Okay. So what is the highest hemoglobin A1C a patient can have before surgery?
The highest what?
You're talking about HGB A1C. I think the A1C is different from hemoglobin, right?
Can you tell me this, the A1 what?
A1C, like their blood sugar, I think. They're
Okay,
talking
okay.
about what's the highest blood sugar they can have before surgery. I don't think there's a problem there, right?
No, that is not a problem. It's only talking about the control diabetes. We have to have it because we have to be ensured that the patient is how was the control in the last months, but we don't have any problem with the glucosylate hemoglobin, that is the A1C. The patient could have the control and it's and not control hemoglobin glucosylata, but the patient could go to the bariatric surgery. The bariatric surgery, it's going to help to down the A1Cs.
Can you talk about acid reflux and gastric sleeve patient and gastric bypass, and what is the criteria and how do they know like we need to get bypass or sleeve if we have reflux problems?
For example, if the patients present reflux all the time, all day, and the patient has to take all the time the medication for the acid reflux, the better procedure is gastric bypass. If the patients only present the acid reflux occasionally, it depends when the patient eats some food, some specific food, it doesn't mean that the patient had acid reflux. It's related more than that about the food. In that situation, we prefer the sleep. But if the patient have an endoscopy before and the endoscopy say that the patient have esophagitis, that is the damage of the esophagus about the reflux, we prefer to advise the gastric bypass because it's a problem that in the esophagus, and the gastric bypass is gonna help to the reflux.
I see quite a bit of questions that they're asking about medical tourism insurance. So there are a couple of companies. I think I know one in Mexico and one in US that they provide medical tourism insurance, and we highly recommend that. With 400, maybe 72, I'm not sure exactly, is 400 something. that you can purchase this additional coverage, and basically it covers complications before you leave Mexico or after you leave Mexico. And it has some other travel related benefits. Incidentally, we are one of the top providers in this space, and we are working with that company to get a large discount, heavily discounted rate for our patients, and we'll be including that soon, hopefully in our packages, so you have option to include that easily in your package. I think it's a great idea. Of course, complications happen very few, but you know, it's good to have coverage and not need it, and not having coverage and need it. You know, I'm personally, when I travel, you know, even with the airlines, I buy the insurance. You never need it, but in case you have delays, for example, or something happens, you have that accessible to you. So that's something we're working on. But meanwhile, there is a page on our website called Medical Tourism Insurance. I put the link, and you can purchase that service from them. Hopefully, we will roll out this program that I was talking to you about, maybe in a couple of weeks. Just stay tuned. We would let all the people who are already in the calendar have to get the option to add it to their packages, and anything that gets booked from here on at that time, of course, you will have option to be included in their package. So just stay tuned and we will let you know. We are also working on our own surgery center, and that's pretty much coming along pretty good. We would have maybe by December, hopefully January, we start operating gradually and moving our patients from the current hospital to there. So they're asking if a patient has breathing issues, how did you do the laparoscopic surgery?
If the patient's what?
Breathing issues, like they have a hard time breathing, is that going to affect their surgery?
It depends. It depends how issues that the patients have. For example, if it's an only an inflamed situation, we could treat the inflammatory situation. But if it's something about the anatomy, or it's something about the pulmonologist, we prefer that the pulmonologist send us a record, an explanation about the situation of the patient. It depends. Some things could manage without problem, but another we have to have all the information about the pulmonologist or otorhinolaryngologist. If is the case, we prefer to have all the previous information, and after that decide to do or not to do the surgery.
So somebody is saying, I have hypothyroid. Can I get mini sleep? I don't know what's their BMI. Let's ask them.
Yes, but it's the problem of the thyroid. Or
Yeah, This thing, if I have hyperthyroid, can I get me sleep?
But it depends, like you said before, it depends the BMI, and but that situation is not a contraindication for a mini sleep, but we have to analyze all of the case.
We do remove a lot of lap bands and we convert it to gastric sleeve or bypass. So it's not an issue for us to do a revision. That happens almost every day. So if somebody has had hysterectomy and they gain weight, does the surgery help them?
Somebody have what surgery?
Hysterectomy. Hysterectomy? Hysterectomy.
Gastrectomy.
Hysterectomy. H-Y-S-T.
Hysterectomy?
Hysterectomy, yes.
Okay.
Yes.
And what is the question?
They said, and I had a weight gain because of that. Is the weight loss surgery going to help me?
Oh, yes. It sometimes happens with the hysterectomy. The take off the ovariums, and it's a hormonal alterate. That's why the patient could gain weight after that kind of surgery. But bariatric surgery could help in that case.
So pretty much, if the conditions that may disqualify you for surgery is like if you have damage in your lungs, for example, you have heart issues, and even if you have heart issues and you put it on your health questionnaire, the surgeon is going to ask for more documentation, more tests, maybe a stress test. And we know like if you really qualify, but those are the things that disqualify you for surgery. Another thing that we mentioned, if you come in and your hemoglobin levels are low, you need blood transfusion, and that's gonna maybe interfere with your surgery. There's been a lot of questions about what is the percentage of weight you lose after gastric sleeve or bypass?
What is what? I don't hear you.
Well, how many percent of their body, excess body weight do they lose after a gastric sleeve? I think you answered that before.
Yes. Before, in the gastric sleeve, it's around 65 to 70% of your excess of the weight, and in the gastric bypass is to 70 to 75. It's not a big difference, but it's still more weight loss in the gastric bypass, but it's not a big difference. It's around out.
So I'm trying to see if we covered everything here. They're asking, what medications do you use for induction of intubation?
Sometimes it depends of the patient, but the anesthesiologist use different medications. It could be fentanyl, it could be propofol. It's one of the most frequently medication of induction, but it depends on each patient too.
So the prices that we have advertised is for cash option, which means if you, I mean, when we say cash option, it means cash you bring, of course, to Mexico, or cashier's check, or things like that. If you pay with credit card, there is a 5% extra fee, but we do have Zelle option. We have bank transfer. You wire transfer. You pay $20 for wire transfer, but we have all these different options. You are required to either be fully paid or tell us how you pay. Like if you're taking a cashier's check with you, send a picture of it to us 15 days prior to the surgery. That way we know your files are complete. The sooner your files are complete, the better you are, because we don't have to worry about all these other side issues, and we will pay attention to your surgery itself, especially when you get down there. You want all your stuff in place. Okay, I think honestly, looking over, we pretty much covered a lot of things that was asked. Okay, so let's continue the presentation here. Okay, that one, and then I'm just gonna share quickly with you some of the before after pictures. We have our support group is a great place to have before and after surgery. You get to see what other patients are doing, what they went through. They share their before after pictures. They are, inspiration for you. And these are bariatric vitamins I was talking to you about. These are Emerge Bariatrics, which is specifically made for patients after bariatric surgery. And you get exactly the amount of nutrients that you need. And this is a high quality vitamin. It comes in soft chew, chewable, drinkable capsules. You can order it when you are signing up, or go on emergebariatrics.com and order it for yourself. It's essential to keep this up and keep your diet up for long term, for healthy bones, for nerves, long term. We talk about 8 to 10 years. These are all essential elements to follow. We are getting to a point that we need to do our raffle. So okay, the winner is Elijah Brown, and I see her still here. I'm gonna let you talk. Are you still there? Elijah Brown.
Yeah, I'm here.
Okay, great. Sorry. So go ahead and share your experience with us. How did you learn about us? How did you learn to attend this webinar?
Well, I was pursuing weight loss surgery in the US, and it was really complicated, and I was having a lot of issues. So I started looking at weight loss surgeries that were being recommended on some Facebook groups. And I think I ran into this one on one of the Facebook groups, and then I looked at the website and I kind of filled out some information, and I guess here I am.
Okay, great. Well, great to have you. Congratulations. I don't know who your coordinator is, but you can contact them today and make sure you get on the calendar and use that $2,000 off of your surgery. I like to appreciate and thank every one of you that joined us today. Have a great rest of the day, and we hope to see you down there in Mexico. And Dr. Osuna, thank you so much for your time and attending this webinar. Thank you, everybody. Goodbye.
Thank you. Thank you. Congratulations. And thank you for being here and for inviting me.
Take care. Goodbye.